everyone. We're delighted today to recognize some up-and-coming difference makers. Established in 1956, the Robert Wood Johnson Awards are presented to one student from 6 Canadian universities offering a Master of Health Administration. Recipients are selected by their respective faculty for their individual achievements and promising contributions to the health services management. On behalf of the college and our members, I'd like to applaud Johnson & Johnson MedTech for their continued support for this award. Thank you. I believe that it's vital that we recognize excellence and to support our emerging leaders. Without further ado, I'd like to invite Anush Pasrija, Vice President, Strategic Customer Group Canada with Johnson & Johnson MedTech, to take the stage to introduce the 2023 Robert Wood Johnson Award recipients. These individuals are joining an exclusive group of health leaders. We look forward to following their careers.
Thank you, Brenda. Good afternoon, ladies and gentlemen. On behalf of J&J MedTech, or Johnson & Johnson MedTech, I'm thrilled to be here today to recognize outstanding talent within the Canadians' Masters of Health Administration programs. We'd like to thank the Canadian College of Health Leaders for providing this opportunity to honor 6 recipients of Robert Wood Johnson Awards and welcome them into the esteemed community of Canadian health leaders. The Robert Wood Johnson Award has a significant history. I think we just heard 67 years, way longer, way more than my age. Somebody asked me that question, I think 2 weeks back, saying, since when you've been giving this award, nobody could easily find that information. So you can imagine it's that far long. Took us about like 5 days to find that information. Sorry about that. We should have known, it's our records, but we didn't forgotten this. But committed. And it provides an important link between Johnson & Johnson and these 6 Canadian universities that offer the Masters of Health Administration program here. For over 65 years, one graduate from 6 universities, which is University of British Columbia, University of Alberta, University of Toronto, Ottawa, Montreal, and Dalhousie universities. These students, as chosen by the faculties from their respective institutions, best exemplify the skills, knowledge, and attitude that's necessary to practice healthcare management in Canada in 2023. And as you know, the theme for this year is Reunited. I don't know who's keeping a track. Somebody said we have to count them. 14, okay. So with that theme, we are pleased to be reunited here, especially for me, because my onboarding with J&J was predominantly virtual. I just joined 2 weeks before the pandemic started, so I just didn't have opportunity to meet so many of us. So I am personally very excited that I'm seeing so many faces here. I'm meeting some people that I had been talking to them always on the screen. I'd never seen them in the 3D. And we are absolutely pleasured, reunited in person, which is for the celebration for these awards. And if I really look back on the last 3 years that I've been here in Johnson & Johnson, and all the Canadian healthcare system that we've been really enduring, one word really comes to the mind is resiliency. I was actually tracking a lot of troubles that the rest of the world was going through in its system. I think Canadian healthcare system really kept abreast of a lot of things even during the pandemic time. If you really see the level of mortality or number of patients that got into the hospital, it was overwhelming. Yet, our mortality rates were, relative to the rest of the world, was still lower. I think the system really did a great job of how do we manage the crisis. Our system was absolutely put onto the test with the COVID-19, and there have been many, many lessons that we have learned, not only just as an industry, but even as a healthcare system, even as communities, even as Canadians. And there were a lot of stories we heard, both for hope and despair, that moved us a lot, all of us. I'm sure we'd had friends, families, somebody or the other we always knew that had got impacted, and it wasn't easy. I think we all came through a little challenging time, a deeply challenging time. But collectively, the ingenuity and the resolve of all our healthcare leaders, especially you in the room today, and all other across the care continuum, made a meaningful difference along. So as we come together for the 15th time reunited in person for this conference, for the first time in 3 years, each one of us an opportunity to really commit to this system and make it what I like calling crisis-proof or pandemic-proof. I think we have evolved through this crisis in a way where we have learned a lot of lessons. I think we have built a certain level of flexibility and agility to really manage even during the crisis. This was the first lesson learned, maybe like 100 years later, as people kept talking about the Spanish flu or the first large global pandemic. After 100 years, I think the system really has learned to now co-survive or co-live with it and really manage it efficiently. But moving forward, I think our system still needs to make certain changes to become really crisis-proof. I will not talk about how and why. I think you are the health leaders. You can certainly figure it out. But if you remember, Thomas Edison had once said famously, when you exhaust all possibilities, remember this, you haven't. So I think we can still keep trying. We can do a lot more. And we really need to make this system crisis-proof. And the time for us is to really look at, give it a fresh look and see what's truly working and what's not working. For example, where do the patients really need the care? Can we get closer to them? And when they need it. Access, when they need it, and where they need it. What can system do to reset itself so that the care continuum is able to look at those kind of shifts of burden and not simply put everything necessarily all the time in the hospitals, because hospitals also have to manage a lot of other complexities. What may not be able to prevent the next crisis, I know it's inevitable, it's mankind, it's the earth. We can always have another crisis. However, we can be really prepared for it differently coming out of this pandemic. So this is where I think our emerging healthcare leaders can play a role, all of you here in the room, and which is why we as an organization are so happy to support these winners, because you are the future. You are the ones who can actually really build that further resiliency and make the system crisis-proof. So it's exceptionally, I think, an opportunity not many get in their career to have that level of impact. So thank you for all that you've been doing for the system. And with that, it's my great pleasure now to introduce you our 6 emerging healthcare leaders, the recipients of 2023 awards. And our first honoree is Kate Mason from Dalhousie University. Kate Mason is a registered nurse with a specialization in palliative care, and she has recently completed her Master's of Health Administration degree, which helped her secure her current role as the manager of Valley Hospice, as well as the Community Palliative Consult team for Southwestern Nova Scotia. Kate is also an active volunteer in the healthcare sector to support her local not-for-profit hospice during COVID-19 pandemic. Kate founded a memorial bike ride for Hospice Halifax, which has raised more than $70,000 over the last 3 years. She's also a patient research partner for several projects aimed at improving the lives of patients with IBD. It was her experience as an IBD patient in her late teens that sparked her curiosity about a career in healthcare, and is therefore able to use her experience both as a patient and as a frontline nurse when making a decision as a health service manager. Please join me in congratulating Kate.
Hello and good afternoon. I'm so grateful to the CCHL for creating this event and bringing us all together, to Johnson & Johnson for sponsoring this award and enabling me to be here today, and to Dalhousie University for my nomination. As was said in my introduction, I have a varied background. I started my healthcare journey as a patient, then became a nurse, sprinkled some research along the way, and now I'm happy to be landing in healthcare management. And I swear I didn't get an early read of Linda's session this morning, but as I wrote these words a couple of months ago, I was reflecting on the importance of curiosity in my journey in healthcare so far. I was a really curious patient, and that's what led me to be a nurse. I was a curious nurse, and that's what led me to my Master's of Health Administration. And I'm here now today, I think, more curious than ever, also more hopeful than ever, and I can't wait to see where that curiosity takes me next. Since I have this rare opportunity to address a room full of healthcare leaders, I wanted to take the time to thank you for all of the work that you do. Depending on your role, I know you may not get to see the impact of your work firsthand. You may be more sort of behind the curtains. But speaking as a nurse and as a patient, I hope you know that what you do, it truly matters, and it's so appreciated. Whatever your title, I'm sure that you can and that you do make a difference in the lives of patients, families, and frontline healthcare workers. And now more than ever, they really need you. So thank you for continuing to show up for this challenging and rewarding work. I am honored to be considered a part of this community, and I wish you all a wonderful day of connection and inspiration here at the conference. Thank you.
So our next honoree is Jennifer Chu from University of British Columbia. Jennifer graduated from UBC with a Bachelor's Science in 2012, with a Bachelor's in Pharmacy in 2016. She has worked as a pharmacist with the Providence Healthcare in the front line of the opioids crisis in British Columbia, where she found her passion for providing substance use disorder care to one of the most marginalized populations. At present, Jennifer is in her second year of Masters of Health Administration program at UBC. With her learning, she wants to work towards better access to culturally safe and trauma-informed care, especially for the vulnerable populations in the community, and shift care approaches from reactive to proactive for patients with substance use disorders. Overall, Jennifer hopes to become a mindful leader in healthcare who works in collaboration with the patient's lived experiences as equal partners. Please join me in congratulating Jennifer.
Good afternoon. My name is Jennifer Jun, and I'm a student with the MHA program at UBC. By training, I'm a pharmacist. I provide care to patients with substance use disorder in Vancouver's downtown east side. You may know it to be a neighborhood with a complex set of social issues, including homelessness, poverty, and crime. But I also know it to be a community with so much strength and resilience. I actually went into the MHA program wanting to become a better advocate for my marginalized patients. And I felt confident considering my frontline experience and my passion and empathy for my patients. In hindsight, that was quite naive, but my heart was in the right place. What I've learned from the program is the reality and complexity of becoming a mindful health leader. I now know that it's about knowing how to adjust your lens appropriately. So a leader should not only be aware of and deeply care about what's happening at frontline, but also consider competing priorities and manage the system at the back end. It's about having empathy, but also being able to look at the numbers and critically evaluate them. Sorry, I'm finding myself. Finding the right balance seems like a daunting responsibility, but I feel inspired and encouraged by the current healthcare leaders that I've had opportunities to learn from. I want to end by thanking everyone that made it possible for me to be here, the MHA program at UBC for the learning opportunity and support, my cohort for making my journey more fun and meaningful, and my family for being my village. I am a relatively new mom. I have a daughter, she's turning 1 in a couple of weeks, so I am incredibly grateful for my village. Thank you again for this award. It truly is an honor.
Our next award recipient is Daniela Cotes from University of Montreal. From a young age, Daniela has been passionate about physical and mental dimensions of health. In 2019, she earned a Bachelor's of Arts in Psychology from Concordia University, and after graduating, she was proud to join St. Justine's University's Hospital, renowned research center, which is located in Montreal. Daniela is enrolled in the Master of Healthcare Administration program at the University of Montreal and is set to graduate this year in 2023. During her studies, she became passionate about quality in care. In particular, she developed a profound interest in patients' subjective perception of quality, which she firmly believes to be a crucial element in the ongoing quest for excellence across the healthcare system. Most importantly, she aspires to become a committed health leader whose work contributes to creating the best possible experience of the care for patients of all ages and from all walks of life through kindness, compassion, respect, and dedication. Please join me in welcoming and congratulating Daniela.
Good afternoon. I feel truly honored and humbled to be here today receiving this award and representing my university, Université de Montréal. To me, receiving this award is more than a recognition, it's a responsibility to continue my quest for excellence in improving the healthcare experience of patients across the system, and ultimately their health and well-being, which is, of course, what we're all passionate about. It is a responsibility that I will truly honor in my work every day through kindness, compassion, and dedication. I would like to thank Johnson & Johnson MedTech, the CCHL for this opportunity to be here, my university's faculty for the potential they have seen in me, my family, particularly my partner who is joining me here today, as this achievement would really not have been possible without their love and support throughout my academic journey. And above all, I want to thank God for this great blessing. Thank you very much to you all for the work that you do every day. Thank you.
And our next honoree is Claire Tizzard from University of Alberta. Claire began her career pursuing her interest in brain health by earning Bachelor's of Science, honors in neuroscience and mental health from Carleton University in Ottawa. During this time, she gained experience working in a nonprofit in Newfoundland and Labrador, supporting healthcare professionals in rural and urban settings to provide dementia-informed care. Through this experience and with mentorship from her professors, she developed a passion for knowledge mobilization and an interest in developing evidence-informed policy to promote health for all. This led her to pursue the University of Alberta's Masters of Public Health MPH degree, specializing in health policy and management. She intends to develop her leadership experience by remaining active in her community. Upon completion of her master's program, Claire will be employed as a research and policy analyst with Alberta Health. She looks forward to expanding her experience and knowledge to promote health for all. Please join me in congratulating Claire.
Hello, and thanks again for this award. It is truly an honor to be here at the national conference to accept this award, and it is an honor to be recognized with this award. I want to thank the University of Alberta School of Public Health for nominating me for this award and for the incredible mentorship and training that I received there, and their encouragement to really continue pursuing a career in health leadership. I also want to acknowledge the mentorship that I received from my peers and my professors at Carleton University, who really encouraged me to pursue further education and brought me here. And finally, I want to acknowledge all of my fellow award recipients. I look forward to building professional relationships with you all in the future and really continuing to transform healthcare leadership and the healthcare system in Canada. Thank you very much.
Our next award recipient is Brent from University of Ottawa. For nearly 20 years, Brent has excelled in senior finance roles in the private sector, most recently for a startup company whose mission is to foster a holistic approach to healthcare and supporting individuals through their wellness journey. This is a cause that Brent became increasingly passionate about. Focused on improving healthcare navigation for patients and caregivers alike, he completed MHA at University of Ottawa, where his passion for primary care was born. During his residency at Prix Health in Ottawa, he evaluated primary care models in Ontario and designed unique primary care clinic to be integrated into the long-term care environment. Excuse me. Brent was awarded from Telfer School of Management MHA Alumni Association Leadership Awards and continues to pursue his passion and project with Prix Health today. Brent actively serves on the several boards of directors for non-profit or not-for-profit organizations aimed at supporting and serving patients' populations locally and nationally. Please join me in congratulating Brent.
Good afternoon, everyone. Robert Wood Johnson had a reputation for fostering innovation and collaboration between industry and healthcare. That collaboration, that team-based approach, forms the essence of the MHA program, which brings myself and my fellow award recipients here today. No doubt if you attended the gala award dinner last evening, you noticed that the projects being awarded were very strong in terms of collaboration and team-based work. Perhaps not coincidentally, primary care, the key foundation for healthcare in Canada, is also team-based in many regards. Apologies, I'm just a little bit nervous. Team-based care forms the foundation of healthcare in Canada for so many. It's the gateway for so many to enter the health system. From the development of a vaccine to combat COVID-19 to primary care, it is that gateway that individuals seek at their most vulnerable times. Collaboration is that central pillar. The MHA offered me an opportunity to develop a new passion within me. And as nerdy as it sounds, I was pursuing primary care models in Ontario, bringing together caregivers in collaborative practice to care for those in our communities and most vulnerable populations. This is work that I continue to do today, as you heard, with Pearly Health, developing and establishing team-based models in Ottawa. I'd like to thank Johnson & Johnson MedTech for this wonderful privilege, the CCHL for putting on this wonderful event. I'd like to thank Pearly Health and their CEO, Aiko Schaffer, Chief Medical Officer, Benoit Robert, for the opportunity to pursue this newfound passion. I'd also like to thank the University of Ottawa Telfer School of Management for the MHA and the opportunity it's provided, as well as Dr. Marujana, who's in attendance this afternoon, and her team for putting on the MHA the way that they do. I would also finally like to thank my MHA cohort, who became my team and my support and are to this day. Thank you all very much. It's wonderful to be reunited with you here this afternoon. Thank you.
And our final, 6th award winner recipient is Sahan Ansafi from University of Toronto. Sahan Ansafi is an emergency medicine physician assistant with 10 years of experience working at the University Health Network. In 2019, he was awarded the Tom Ashman PA of the Year Award for his commitment to provide high-quality patient care and in advocating for the profession across Canada through the engagement of hospital leadership, ministry officials, and elected officials. Suhan is a passionate clinical educator with experience educating all members of emergency medicine team. He has also held various positions as faculty at McMaster and University of Toronto. He looks forward to leveraging the knowledge he gains from pursuing an MHSC in health administration to help increase health system efficiencies, sustainability, and the continued integration of team-based models of care. Through his work, he also hopes to develop innovative models for improving provider wellness while supporting the delivery of high-quality patient care. So please join me in congratulating Sahan.
Good afternoon, fellow healthcare professionals and colleagues. It's an incredible honor to have been selected as the recipient of this award, especially as over the last 2 years I've had the privilege of being part of such an impressive cohort of intelligent, creative, and accomplished health leaders at the University of Toronto, all of whom I know will have a tremendous influence in shaping the Canadian healthcare landscape in the coming years. I would like to thank the faculty at the IHPME, whose innovation and commitment to excellence were instrumental in ensuring we were all provided with a high-yield learning opportunity despite the challenges of the pandemic. I'd also like to acknowledge our incredible team of clinicians and leaders at the University Health Network, and especially our emergency medicine and emergency preparedness teams, without whose support I could not have embarked on this journey. Last but certainly not least, I could not have done this without the support of my family, and most importantly, my loving wife, Risha. Thank you for your unwavering support and for standing by my side through all of my crazy adventures. As I stand here today, I cannot help but reflect on how the many challenges we've faced in the last few years have impacted our healthcare system, particularly in the areas of health, human resources, and infrastructure. Despite the challenges, I've been inspired by the resilience and dedication of the healthcare workers nationwide, and especially those who I can work alongside in the emergency department. Their commitment to providing high-quality care to patients has been nothing short of remarkable. As we move forward, we must continue to support our healthcare workers and invest in our healthcare system. We need to ensure that our staff feel supported and are provided with the appropriate tools and resources to provide the best possible care to patients. I'm deeply honored to receive the Robert Wood Johnson Award. There remains a lot of work to be done, but I am excited to use the knowledge and experiences that I've gained over the last 2 years to work alongside all of you to build a stronger, more resilient healthcare system for all Canadians. Thank you.
So on behalf of J&J MedTech, I'd like to congratulate all the winners, all all 6 of you, and thank you for your focus, your contributions, and commitment to the healthcare system. And you're really responsible for strengthening, improving, and building our public healthcare system. And we are privileged that this group of esteemed leaders will be the change agents for our system in the years to come. So thank you for all what you're doing. And I'd like to now invite Brenda and Alain and all 6 winners on the stage for a picture. So let's reunite here.